Hello, my name is Dr. Michael Corey, and I want to welcome you to this special presentation for patients suffering from thyroid disorders. And I've been in practice for over 19 years. I'm board certified in integrative medicine, and I'm a graduate of the American Functional Neurology Institute, in addition to having 19 years of postgraduate education in the field of functional neurology. Now, all chronic conditions have some similarities to them. So this next slide that I want to talk to you about discusses these. Now, not only for the thyroid patient, but also for type 2 diabetes, for fibromyalgia, for irritable bowel symptoms, for patients suffering from stenosis or Crohn's disease, celiac disease. All these are a combination of neurological problems and metabolic problems. Now, some of those metabolic issues are things like anemia, thyroid dysfunction, unstable blood sugar, your adrenal gland dysfunction, hormone imbalances, hidden infections in your gut or from a viral standpoint, food sensitivities, chronic inflammation, and hypoxia or decreased oxygenation of your tissues. So all these chronic conditions have these similarities in mind. It might be affecting one or more of these, might be affecting a variety of different patients with each one of these conditions. So what I'd like you to understand is all cases of chronic conditions are a combination of neurological problems and also metabolic problems. Now, when we talk about metabolism, we have to talk about energy. Okay, that's what the whole process of metabolism is all about. It's about producing energy. So you eat your fats, your carbohydrates, and your proteins, and your body produces energy, or ATP, to get into the cell to regulate your tissue and your metabolism. So we have to have proper energy in order for you to have proper thyroid function. Now, your 30% of your energy comes from your nervous system. Your nervous system encompasses your brain, your spinal cord, and the nerves that exit your spine and the spinal cord to all your muscle cells and tissues of the body. So we have to have proper functioning thyroid to have proper metabolism of your thyroid, as well as a well-functioning brain. Now, your thyroid has what we call crosstalk with the brain. It's got to continually communicate with the brain and back to the thyroid and back to the brain and back to the muscle cells and tissues to regulate your metabolism. When we look at thyroid symptoms, patients with thyroid symptoms can experience problems such as fatigue, an increase in weight gain even with a low-calorie diet or no matter how much you're actually exercising, morning headaches that wear off as the day progresses, depression, constipation, overly sensitive to cold or heat. We can have poor circulation and numbness and cold hands and cold feet, muscle cramps even while you're at rest. We have sores or wounds that heal slower than what you had experienced in the past. Chronic digestive problems. Very often this is due to the hypochloremia or the increased alkalinity of the stomach. We need to have more acidity in the stomach for your gut function to be activated so you can break down those foods, those carbohydrates, fats, and proteins, so that then your digestive system can carry food away and metabolize properly. We have to get those nutrients into the bloodstream for you to be healthy. Itchy or dry skin, dry or brittle hair, your hair's falling out. I've had patients who were virtually losing clumps and clumps of hair. And as we got them through with the program and we were able to get to the root cause of the problem, we were able to get that hair to grow back. We can have edema, especially puffiness in the face. We can have loss of the outer third or outer portion of the eyebrows. So these are just some of the symptoms due to a thyroid disorder. The next slide, we want to talk about what your thyroid metabolism supports. It supports bone metabolism, so osteoporosis. Okay, when we see osteoporosis, we want to address that thyroid. Your immune system, brain and nervous system function, endocrine system, including your adrenal glands, your insulin, your glucose metabolism, your ovaries, and your testes. So this can affect you from a reproductive standpoint, and it can also affect your gastrointestinal function, your cholesterol levels, and proper stomach acids, as I mentioned regarding the hypochloremia. So every cell in your body has thyroid receptors. Every muscle, cell, and tissue of your body has to have thyroid receptors, which are regulating the metabolism of those organs and tissues. And so I think you can see why this is so very, very important. It's affecting astronomical percentages of our community and of our population. Now, there's some reasons why. Because your thyroid has to have the crosstalk, as I mentioned, back to the brain. But in addition to communicating with the brain, we have to have thyroid communication back to the immune system We have to have thyroid communication back to your gut. We have to have thyroid communication back to the brain. We have to have thyroid communication back to the endocrine system. So one affects the other. If we lose communication with any of these parts, then we're going to throw off metabolism in your body. So this is a diagram that I want to explain the cascade of how the thyroid works and how your body actually metabolizes. Sometimes this can get a little bit deep, but I'm going to keep it very simplistic so everybody can understand. So your hypothalamus, which is up in the upper brain, will release thyroid releasing hormone down to the pituitary gland. Now the pituitary gland in turn is going to release thyroid stimulating hormone, which is what you see on your blood test that your doctor's probably run the test. It's either been high or low, and he's diagnosed you with a thyroid disorder. After we get the release of thyroid stimulating hormone, we're going to stimulate the thyroid gland. And it's going to produce a release of thyroid peroxidase. And within that thyroid peroxidase, that's going to help with the release of two hormones. We've got T3 and T4. Now T4 is an inactive form. The inactive form, we get 97% of that inactive form. Now the active form, T3, that actually gets into the cell to do its job, we only get 3% of that. Does that make sense if we have more of the inactive than active? Well, not on the surface, but as we look through, all your systems have to work together in order for you to have normal metabolism and normal thyroid function. So going back, we've got 97% of the inactive form of T4. We've got the 3% of your inactive or your active form of T3. Those are both shuttled off, almost like on a little bus, by what we call thyroid binding globulin. So T3 and T4 are shuttled off in a bus, just like as we go from one point to another. And as it's shuttled off, that T4, the inactive form, is then converted to T3. So that transformation of that T4 to T3 is changed over and converted, and 60% of that is in the liver, 20% of it is in the gut, and the other 20% is in other peripheral tissues. So as that conversion takes place, and now we've got more of the T3 to actively get into a cell, that TBG, that thyroid binding globulin, we drop it off and we see that the free T3 is now able to get into the cell or the receptor site, and then it can get into the cell to actually help with the metabolism of those cells and tissues. So it's a cascade. Once again, let's just go over this real quickly. We have the hypothalamus releasing thyroid releasing hormone down to the pituitary gland. That will secrete, let's go over a couple of things, growth hormone for tissue repair. We're going to go to the brain. We're going to also release luteinizing hormone and follicular stimulating hormone to go to the ovaries and the testes. We're going to also, from the pituitary gland, we're going to affect the adrenal glands to control cortisol, aldosterone, progesterone, DHEA, and also epinephrine and norepinephrine. But the thyroid portion comes back into releasing that thyroid releasing hormone to the pituitary to release thyroid stimulating hormone down to the thyroid gland to secrete the T4 inactive form, T3 active form down to the thyroid binding globulin, so that it can be shuttled off and it's going to be converted from the inactive form of T4 to the active form of T3 by the liver, by the gut tissue, and by the other tissues in the body. That's going to then allow us to have the free T3 that can get into the receptor side of the cell, then get into the cell so it can actually do its job. So hopefully it wasn't too complicated. I wanted to make sure that we reviewed that because there's a cascade of events that have to happen. And if we have a breakdown up at the top and we don't get the thyroid releasing hormone, we can have a problem. If we don't have a problem, if we have a problem as far as not the pituitary gland not doing its job, we can have a problem there. If we're not getting the TPO, if we have active antigens and we're not getting the TPO to give us the T4 and T3 in proper proportions, we can have a problem there. If we don't have the thyroid binding globulin to carry that off to the gut, to the stomach, and to the liver to have that conversion take place, we can have a problem there as well. If we don't have proper gut function, liver function, or metabolic activity to make this conversion take place from T4 to inactive form to the T3 active form, then we can have a problem there as well. So you can see it's not so simple as just taking a hormone that some doctors will just give you because your TSH is higher or if it's low. Now, have you been told that your lab tests are normal but you continue to suffer from symptoms? Okay, that's the topic of this next discussion. Because lab ranges are very inaccurate. They comprise a bell-shaped curve that shows us highs and lows, and those highs and lows are actually accumulation in an average of all the sick people that have had their blood tested at that laboratory. Now we can have differences between New York versus San Diego versus LA because each one of those labs have different averages because different population people have been to each one of those. So we're averaging a population of sick people, and the reason why we use that bell-shaped curving, we want to look at that from a functional standpoint, is because that peak is where the healthiest people are. We want to bring those numbers from traditional lab values in so we can get to that peak, because that's where the healthiest people and the healthiest population of people are going to be. So let's explain this in a little bit more detail. Out here we have abnormally low values. Over here we have abnormally high values. Within the center are laboratory ranges that your doctor looks at out from here to here. And then when we bring those numbers in, we get to the functional ranges. So we're looking once again at the healthiest population of those averages. So in these areas, your doctor is going to say that you're fine. But in actuality, you actually have hyper or hypothyroidism. Now this is not only just with your TSH levels, but virtually for every one of your blood markers. We can look at it from a functional standpoint and look at optimum function rather than looking at sickness care and carrying on with those super wide ranges where we're going to be manipulating those from a healthcare standpoint medically with medications to boost them up or down. But it's just a juggling match, a balance act that hormones do. So we want to get to the root cause once again. Let's give you some specific examples. When we look at glucose, the functional range is 85 to 100. When we look at traditional highs and low ranges of traditional lab values, then we're going to see that those ranges are actually 65 to 110. So what I'd like you to understand is that if you have 73 or you're hypoglycemic, then that's going to be within a range and your doctor's not going to see any problem with it. However, you are outside the functional range. So let's look at TSH now. Within TSH, the functional range is 1.8 to 3, very close. But the traditional lab value your doctor might be using is 0.3 to 5.7. Super, super wide range there. So with a 4.2 TSH level, you're going to actually be hypothyroid when your doctor says that you're normal. Now this virtually happens with cholesterol, triglycerides, or hemoglobin, A1C. Virtually all of your lab tests can be evaluated in both of these ways. So once again, we want to always look at the healthy population. So a true thyroid functional test will include, and what we do in our office, includes TSH, total T4. This is what is conventionally ordered, just those two. But what about these? We have free thyroxine index, or FTI. Okay, this is the amount of the T4 that's actually available. The free T4, this is affected also by prescription medications. T3 uptake, free T3, reverse T3, thyroid peroxidase, we talked about that in that cascade, thyroid binding globulin antibodies, we see these with HASHIMOTOS thyroiditis, TSH antibodies, we see these in Graves' disease. We want to run a TSI test to confirm if somebody has Graves' disease, which we would co-manage with your medical doctor, and thyroid binding globulin levels. So you see it's just not so easy of running a couple tests in plain juggler as far as balancing out just the hormones. We want to get to the root cause of why you're having problems. So the typical thyroid test order is just that TSH and the T4. So how can you manage health without all the information? Well, what happens over a period of time is you start to burn out that thyroid. Okay, you just keep giving the thyroid a bump up and down, and we end up burning the thyroid out because it's not actually functioning properly. In order to manage your health, you need to look at all the causes of dysfunction. And that's what we do in our office with our procedures, with our thorough testing that we provide for you. So Hashimoto's thyroiditis and Graves' disease, this is an immune problem. It's not a thyroid problem. So your immune system is mistakenly just attacking the thyroid peroxidase or thyroid binding globulin in Hashimoto's, or else the TSH, which is found in Graves' disease. So there's an imbalance in your immune system that needs to be addressed. And the only way to identify that is with proper testing. So what would trigger your immune system to cause an autoimmune attack, to attack your thyroid or those tissues or that cascade that we talked about? Well, you can have chronic inflammation from a poor diet. Essential fatty acids have to be within your system. You have to have essential fatty acids to have normal metabolism. We'll check that out. You can have bad regulation of your blood sugar. Anemia is notorious. It's one of the things we do have to correct and improve prior to getting normal thyroid function. Bad adrenal gland function. Adrenals secrete cortisol due to emotional, chemical, or structural stress. And if you have high cortisol, it's going to be bad for the brain. It's going to be bad also for that conversion, that cascade that we talked about. Hormone imbalances. We can have neurological imbalances. Pregnancy or low vitamin D. Leaky gut syndrome. Remember that conversion takes place in your gut. So if you have leaky gut syndrome, then we're not going to get proper breakdown of foods to be converted back into energy. We can have environmental toxins like herbicides, pesticides, yeast, molds, and bacteria. We use a testing and treatment procedure called field control therapy in our office that helps us identify if you have herbicides, pesticides. Mercury, which is very, very common, is far found in several amalgams in your teeth from your dental work. So all of these things can cause a problem and disrupt your body's homeostasis and balancing out the thyroid hormones. Or we can have infections in the gut or chronic infections of bacterial or viral problems. So management and support for a Hashimoto or Graves patient requires proper testing. We have to remove the active antigen, the cause of the dysregulation with you. We have to modulate the immune system. We want to make sure that you have emulsified vitamin D in your system. We'll provide with glutathione, which is an antioxidant, nitric balance, fish oils. We'll remove the stimulants to the dominant half of your nervous system. We've got a balance of TH1 and TH2. And if we're teetered over to one side, your body can't take care of its proper immune function because there's a dominance on one side versus the other. So we do have to balance the TH1, TH2. We can have herbal compounds. We use Apex Energetics, and we also use a company called Premier Research Labs for a lot of our supplementation. Premier Research Labs in particular focuses on not having any excipients in the nutrients. Excipients are additives, fillers, and binders, which can confuse the ability to transport that nutrient back into the cell. Your body doesn't identify as that nutrient being beneficial for you. And we've seen in the news where we have major nutrition companies who are being not diagnosed, but we're being identified as not actually having the proper nutrients in the nutrients that people are purchasing or what's actually on that label. Well, I don't worry about either one of these companies when we order supplements from these companies for our patients to help with their regulation and getting their thyroid back on track again. So it's very important to have proper supplementation. Don't go through and just get the generic supplements. We have to have proper supplements with realistic nutrients in those so that we can make sure that we can get you well. 6 major thyroid patterns. And we've got primary hypothyroidism, we've got hypothyroidism, secondary to the pituitary problem. Remember I showed you the breakdown as we went along? We can have thyroid underconversion where the T4 does not get converted back over to the T3. We can have problems with the thyroid overconversion and a decrease of that thyroid binding globulin to carry the active hormone into the cell. We can have thyroid binding globulin elevation from contraceptive use and also from hormone replacement therapy. And we can have the thyroid resistance due to just that constant pounding of the thyroid trying to get into the cell, which it can't do. So primary hypothyroidism, this is when the thyroid gland gets lazy and the pituitary gland tries to kick it in its pants and pump up that extra thyroid stimulating hormone. So we end up with a high TSH level. It's the only pattern of the 6 that need hormone replacement. And we'll co-manage our patients with those. Hashimoto's may also be present where we have to regulate the autoimmune condition. So it's very, very important to always get to the foundation, even if you are taking hormones. And we want to make sure that if you do have to take the hormones because you have primary hypothyroidism, then we also support that nervous system and the immune system. Nutritional support, if cautery, can reverse this pattern. We use porcine thyroid gland, we use ashwagandha, we use vitamin A, D, selenium, and zinc to support the T4 to T3 conversion. We use GLOBULIN. We also use antiperoxidative compounds. So we have a plan for our patients when you're suffering. We want to make sure that you're properly supported. We have the second type, which is hyperthyroidism, secondary to pituitary hypofunction. This is when the pituitary gland gets lazy. We get a low TSH, below that 1.8 optimal low end of the range. This will produce chronic stress and fatigue of the gland. It'll produce hormone pills, and it'll be produced by hormone pills, including the Thyroid, creams from estrogen, postpartum depression, fluctuating insulin glucose levels. Once again, we have nutritional support with those, but we want to always support the adrenal glands because of that spiking cortisol levels, which can throw off the overall function of the hypothalamic pituitary cascade and that HP axis connection. Next one that we want to look over is a thyroid underconversion, and this is when the gland is making enough T4, but there's a decrease in the conversion of that T4 to T3. Now, why does this happen? We can have chronic adrenal stress, going back to the adrenal glands and that cortisol spike. So we're going to suppress the T4 to T3 conversion in that process. We can also have chronic infections and inflammation. Chronic infection and inflammation, we have to handle that, just like the anemia I talked to you about earlier, to get you well. This is often missed because low T3 doesn't affect TSH, only the T4 does, and T3 is rarely checked on your regular blood test. Many of you have never even had the T3 checked from your primary care physician. What we want to look at next is our type 4, or our thyroid overconversion and decreased thyroid binding globulin. Now, this is caused when we have too much active T3 is made and is overwhelming the cells, or too little thyroid binding globulin to actually produce, which produces too much of your free T3. Now, why does this happen? So what we can have is this is the #1 cause of insulin resistance. And as we look at this, the cells are not listening to the insulin, so more insulin is secreted. This regulates the blood sugar wrong. It produces stress on the system. This increases testosterone levels in the females and results in too much of the free T3 to too little of the thyroid binding globulin. So for nutritional purposes, we stabilize the blood sugar, insulin levels via diet and nutritional compounds. And in this case, we use the Apex products, adrenochrome, adaptogen, glycine, and proteoglycine to regulate that blood sugar. Now, thyroid binding globulin, or TBG, elevation can be caused due to overuse of oral contraceptives, or estrogen replacement therapy causes an increase in the estrogen, which leads to increases in the thyroid binding globulin. Nutritional support, in this case, we use things like choline, beetroot, betaine hydrochloride, milk thistle, dandelion root, glutathione, vitamin C, and the list goes on, depending on the patient's condition and their presentation. Now, the last type that we're going to discuss is thyroid resistance. This will occur when the pituitary and thyroid glands are fine, and so are the hormone levels themselves. However, the hormones aren't getting actually into the cell. And we ask, why does this happen? Well, chronic stress responses stimulates the adrenal glands to produce too much cortisol, which causes the cells to be resistant to the thyroid hormones. Now, we provide nutritional support in this case as well. This addresses adrenal dysfunction. So I think you can all see why the adrenal glands are so important in this case. So the adrenal glands, if they're stressed, they're going to produce high cortisol, which is going to increase the inflammation in the brain and throughout the system, and interrupting this cascade of functions that have to occur at every step to give you normal thyroid regulation. So next thing that we're going to do is we're going to look at thyroid dysfunction, because every thyroid function has a metabolic component to it. So proper testing is very, very important. And when we look at proper testing, we're going to run a complete metabolic panel. This is going to include the complete thyroid expanded profile, like I outlined with you earlier, including the thyroid autoantibodies. It's going to encompass the vitamin D levels. We're going to look at anemia. We're going to look at kidney function, your hormone testing. This is a salivary test. We're going to look at 24-hour cortisol levels, because we want to regulate and evaluate how that adrenal function is working. We're going to evaluate your estrogens, your progesterone, your testosterone, and we also use a company called Cyrex Labs. And Cyrex Labs will help us to uncover if you have a leaky gut syndrome causing a problem in the gut, which is where all that conversion takes place. We're going to identify whether or not you have a gluten sensitivity, a soy sensitivity, a yeast or an egg sensitivity, and we're going to check also the autoantibodies And we're going to see if you're actually having a reaction due to any of the 24 different foods that we test. So what we want to look at next is that if you do have gut dysfunction, we're going to also send you out for a stool microbial ecology profile. This will help us identify whether or not you have gut infections. If you have parasites, yeast, mold, or bacteria within the gut lining, these things can also cause a problem. So you can see it's just not so simple to give you a medication and send you on your way, because many of our patients are on the medications when they come in, and as we resolve the underlying causes of the problem, then they can slowly work with their medical doctor to slowly come off of those hormones as we get to the core cause of the problem. Now, what makes our office different from every other office you've seen? Well, we manage you neurologically and metabolically, and from a toxicological position. We want to identify if you do have toxins that we need to help remove and get out of your system so that your body can start to work properly again. It's like a roadblock in your nervous system and your immune system if you have toxic problems. So we manage and support patients neurologically, metabolically, and toxicologically. And I'm here tonight to let you know that there's no stone that's going to be left unturned to help getting you well. So we leave no stone unturned to make sure that we cover all aspects of your evaluation so that we can get you well. Based on lab findings, our nutritional products are dispensed to support biochemical pathways for healing the gut, the thyroid, the adrenal glands, your liver, your gallbladder, any anemia problems, sugar regulation, and your autoimmune regulation problems that you're having. So we're going to provide you with a comprehensive neurological and metabolic workup. The neurological test will include your right and left blood pressure. I don't know if your doctors ever checked both the right and left side as far as with your blood pressure. We're going to look at tissue saturation. We're going to look at heart rate and rhythm. We're going to look at your reflexes, your eye test. We've got 12 cranial nerves. We want to evaluate the cranial nerves because, like I said, this is a neurological problem where we can evaluate the left and right brain. We want to see, is one working high and one is working less efficiently? If we identify those things, we're going to provide brain-based therapy, which is going to help regulate these and balance these out. We're going to also check for the cerebellum test, which control your accuracy, your balance, and your coordination. Cerebellum is the first area that's stimulated through what they call 1A afferents, regulated by gravity on your spine. That stimulates to regulate, once again, your accuracy, your balance, your coordination, plus that whole stimulation to the cortex of the brain on the opposite side. We're going to look at metabolic tests such as your blood sugar levels, adrenal function, cortisol levels, your thyroid hormones, thyroid autoantibodies, female hormone panel, GI permeability test, and your immune panels. So we're very, very thorough in our evaluation. We've got to understand that metabolic problems produce neurological problems. This is regulated once again from food being converted to energy. So 30% of that energy goes to the brain, regulating your immune response and your nervous system. So when we have neurological problems, we're going to have things like abnormal sensation, we're going to have abnormal movement, we're going to have abnormal brain function or cognition. A lot of patients with thyroid problems go around with something called brain fog. They just feel like they're walking around in a haze on a regular basis. And we can have abnormal posture due to the cerebellum not working properly. 70% of the brain's function is actually a brake pedal. It's there to inhibit the functions of the brain, to slow things down so things can be processed and sent back down to give what we call efferent signals down to the body to tell the body what to do. If it was just bombarded with so much stimulation, we'd always be in a fight or flight response. So we'd have rapid heart rates and we'd have all these other issues, perfusions, constant sweating, and complete insomnia. Those are the symptoms that happen when we have sympathetic dominance. So weakness in one area of the body increases firing to all other areas. And the brain's primary function is to slow that impulse down so that it can be regulated properly. The two areas that need to be inhibited the most are the sympathetic nervous system, that's the fight or flight that I just talked to you about, and also the limbic system, which regulates your emotions. So what we want to look at as far as with the sympathetic escape, these symptoms will include things like headache, sensitivity to light and sound, hormone imbalances, high blood pressure, poor digestion, frequent urinations or urinary tract infections. We can have poor sleep. We can have cold hands and cold feet because the sympathetic nervous system is not regulating, so we don't go into a parasympathetic response, which increases circulation. We can also suffer from chronic pain. Now, when we have symptoms of the limbic escape, that's going to affect you, and it's going to cause irritability, it's going to cause a lack of your focus, anxiety, obsessive compulsive disorder type of symptoms. We can have depression, and we can have large mood swings. So if this describes you, now this is very, very often what the case is if you are suffering from a thyroid disorder. The most active area in your brain is the cerebellum. Remember, I talked to you about accuracy, balance, and coordination. So are you clumsy? Do you have neck and back pain? Do you have vertigo or balance problems? Are you having visual disturbances? All these can be due to a cerebellar issue. So what can be done? Well, we do brain-based therapy. Brain-based therapy provides activation and oxygenation and fuel delivery to your system, which are the foundations of health. So as we help your body regulate itself with fuel and activation, we can stimulate that cerebellum and get things improved. Now, in science, this is a decade of the brain that's been touted by Time magazine. And the magic word is neuroplasticity. Neuroplasticity is the ability for nerve connections to develop other connections so that we can have better communication within the nervous system. So we want to look at this. If a nerve has damage to it, in many cases it can be healed and repaired through neuroplasticity. Increasing the frequency of firing through that pathway so we get more connections so that we get the function back. So how does this happen? Well, when we have these stresses on our body, stresses can be produced through chemical stress, physical stress, or emotional stress. This causes the brain to fatigue, and we get fewer of these nerve impulses. So neuroplasticity, or that increased frequency of firing, is very, very important for the thyroid recovery. We want to address it neurologically and metabolically. Chemical or physical stress to the brain can be produced because of anemia, too little oxygen actually reaching the cells, blood sugar problems, glucose imbalances, food sensitivities like the gluten, the soy, the dairy, the wheat. We talked about that. We have genetically modified foods now. We've got herbicides, pesticides. All of those things can cause a problem as far as with food sensitivities. Immune system imbalances, imbalances in an autoimmune condition, which is causing an imbalance within the immune system to function properly. Poor diet, or what we call the standard American diet, it causes inflammation, omega-6 to omega-3 fatty acid differentials and imbalances there. Hypothyroid function, prescription and non-prescription medications can all be a concomitant factor as far as with the physical chemical stress to the brain producing thyroid problems, in addition to the hidden infections that we discussed a little bit earlier. So to wrap it up, what we see what can be done. Well, we have to have the cerebellum functioning to the brain, requiring the two things, fuel and activation. Carbohydrates, proteins, and oxygen have to be combined so that we can get the functions back into the nervous system, the nutrients back into the bloodstream to regulate your function. So we've got food, we've got oxygen, produces energy and activation, and what we want to do is we want to look at the functional neurology treatment protocols, because we're going to be looking at your balance, we're going to be looking at your postural makeup. Do you have forward head carriage? Have you lost your courage, or your shoulders rolling forward? If you have a normal gait response. We're going to look at auditory stimulation and helping you with that. We do visual tracking exercises, some light stimulation. We check you from olfactory function, make sure you can not only identify, but also smell from both sides of the sinus. We're going to look at metronome exercises, which control timing and motor coordination. We're going to be looking at planning metabolic endurance and neuroplasticity issues, proprioceptive exercises to increase that stimulation from those 1E afferents, reaching the cerebellum to help the postural distortion, vestibular training, adjustments, rhythm and timing exercises, functional nutrition, and we do many, many more things in here in the office. So we want to make sure that we bring the pieces together to get you well. Metabolic breakdown with neurological complications. Now remember, these are some of the things we talked about up to this point. We talked about the cerebellum. We talked about blood sugar, your hormones. We talked about your cortisol levels and the adrenal function. We talked about oxygen. Your body needs fuel and activation. Oxygen is an important component. Just try to hold your breath for 3 minutes. Our midbrain, everything's got to come together, and we have to be functional human beings to get you well. Now the next thing we're going to look at is correcting the brain, bringing those pieces all together. And as we bring all those pieces together, we have the cortisol levels normalized, cerebellar functioning proper, the midbrain calmed down, the oxygen normalized, the hormone balance, and the blood sugar normalized to get you well and to get that thyroid functioning again. So we have to treat you as a whole person. So the first 2 visits that we provide in our office are complete, comprehensive visits. On visit 1, what we're going to do is we're going to provide you with a complete neurological evaluation. The next thing we're going to provide is that we're going to review the existing lab work that you've had done. So if you've had lab work done, we like to get the past 2 years of lab work. We're going to import it into our software so you can see the functional ranges versus those traditional lab ranges, so you can evaluate how your doctor has actually been managing you up to this point as well. We're going to have you fill out a metabolic assessment form and a neurotransmitter assessment form. These will help give an insight to how the chronicity of your different systems are working over a period of time. We're going to also get you a copy of Dr. Karazian's book, and it says, "Why do I still have thyroid symptoms when my lab tests are normal?" Okay, so you're going to get this when you come in for your evaluation. We want you to be properly educated. We want you to understand the full picture of why you're experiencing thyroid problems. You must be with a spouse or a significant other during the initial examination, and also on the second reported finding day, where we're going to sit down with you and describe the examination findings, in addition to lay out a plan for your recovery. So day 2, we're going to provide further complete testing suggestions. If you need to have the Cyrex testing done, if you have to have the leaky gut test, if we need to send you out for any additional testing you haven't had done, we're going to provide that for you on the second day. We're going to also give you a review of the neurological findings from day 1. So the neurological findings, we're going to review that with you. We're going to provide you with a treatment plan. We're going to review the financial obligations to our care plan. And once again, you should be with your spouse or significant other. Okay? So, you know, we want you to have the proper support. We want your spouse or significant other to understand what you're going through and the importance and the severity of what you're going through, so that you have proper support when you're at home, when you're following our guided regimen as far as getting you well. So what else do you need for your first appointment? Well, we want you to bring shorts and a t-shirt. Okay, if it's cool outside, bring them. You can change prior to the examination. Okay, we want to do sensory testing. We want to make sure that the examination is thorough. You must have all paperwork filled out completely prior to your coming into the office. We need to receive that prior to your visit in the office. It's super, super important, because if we set aside an hour for your examination and you're in the office for 30 minutes filling out your paperwork, we're not going to have the time to do a complete examination. So we do require that you get all of the paperwork into us prior to your examination date. So we accept 5 new patients on a month-to-month basis from our thyroid program. Normal cost of our care for this 2-visit evaluation is $365. Now, because you're watching me probably online, or else you've received a DVD from our office, we're going to provide this for $60. Not the $365 it would normally cost you, but for $60, so we can open up the door and allow you to get the information that's so desperately needed for patients suffering from thyroid problems. We're going to offer this to you for $60 only. Now, if I feel that I cannot help you when you come into the office following the examination, I'm going to refund that money back to you. Okay? So we want to take away any restraints to you getting the proper information and getting the proper evaluation done. I've got 3 rules for accepting your case in our office. Number 1, you must be willing to make serious life changes. Okay? So if we identify issues, you have to take control of your life and make serious life changes to turn this around. That's why they call it a chronic condition. You have to take accountability for your health. Insurance and Medicare only pays a small portion of this care. We made our care plans affordable, so 96% of the people can see us for care, and you need as little as $200 to $400 per month to be able to afford our care. Okay, we have financing available for those patients that can't afford the care with our discounted rates with a first payment or a second payment. So don't put it off. If you are suffering, we can help you out as far as getting financing for our program. Now, on a scale from 1 through 10, how serious are you about your illness and taking responsibility for your illness? How's it affected your relationships, your work, your life, your communication, your experience with your grandkids, participating in an active lifestyle? On a scale from 1 through 10, how serious are you about eliminating the core causes of your illness? And due to time restraints, like I said, we do accept only those patients that are completely committed to getting well. Now, I do thank you very much for your participation and viewing this presentation online. If you have any questions, I'd like you to call our office at 714-730-5833. You can also email me directly at askdrcorey@wellnessstop.com. I thoroughly enjoyed providing a presentation for our thyroid patients out there. We want to make sure that you can get well. Remember, don't wait another day, another month, or another year of suffering when help is available. My name is Dr. Michael Corey, and I wish you the very, very best, and health be with you. If you have any questions, call the office, and we look forward to helping you out. Thank you so much.
I'm Jennifer, and I started seeing Dr. Corey when my endocrinologist diagnosed me with HASHIMOTOS and really said there was no cure and nothing he could do. And just after just a few months with Dr. Corey, I saw definite results. I feel like he taught me new ways to eat and new ways just to take care of my body that were very helpful, and the supplements and the therapies, everything working together. I feel like just seeing lots of different results, my energy, sleep, the nodules I was diagnosed with on my thyroid were gone, and just feeling a whole lot better.
Hi, my name is Caroline, and I came into Dr. Corey on a regular visit, and he noticed that I had a bald patch in the back of my head, and I didn't notice it, and so didn't know what was happening. So I went to my primary care, and they had me see a dermatologist, and then they started a treatment of steroid injections, which I did not like at all, and I stopped it after 2 doses. And then I started having more bald patches. One right here was about this big, completely bald, and didn't know what was happening. And so Dr. Corey had me take a gene test, and it's called, as an abbreviation, the Monday through Friday gene test. I think it's the MTHR. Anyways, so I got the test, and it came back that I had 2 defective genes. It was a gene with 2 defective enzymes, I think. I'm not quite sure, but anyways, so that came back, and then I started getting treated with the supplements that Dr. Corey gave me. One's an immune booster, I think, and another is a oral pill. And once I started taking it, about 4 weeks later, all my hair grew back. So it was a miracle, truly was a miracle, because before I knew it and noticed, even after taking the pill, it just grew back quickly, like a chia pet. So since then I've been taking the pill every day and putting it's a topical cream every morning, and my hair is actually just growing like weeds right now. So, and people have noticed and said, wow, your hair's getting really long, and all the bald patches have grown back. So I'm very happy. Thank you.
Hi, I'm Maria, and well, I come to see Dr. Corey, and it was a godsend that I did, because I was struggling with a lot of pain, and previously, just seeing my primary care physicians, and it just got referred to a lot of different specialists who I just felt, I just weren't taking the time to really treat me. I just won't name names, but I did have maybe one person one day referred to another person the next day, and it was either pills or they would say maybe surgery, and I just really felt I wasn't being heard. And I did try some of the pills that were recommended, and I just felt they made me feel worse, and my pain was just becoming worse, and I couldn't think well, and so I went online, and thank God I felt I was directed to Dr. Corey, because I was very desperate at that point. I really was, and I couldn't take the pain, and I had pain in several places, which they called symptoms of fibromyalgia, and a lot of the times I did feel like people weren't taking me seriously because the pain would be in different places and just in many places, and it was all new to me too. So I was glad to, when I came here to Dr. Corey's office, that he listened to everything and he asked me to list all the different things that were bothering me or where I felt pain, and just for him to be able to tackle the list. To me, first of all, it was amazing that someone would take the time to listen and to try to tackle more than one thing at once. So I felt that he was really listening to me, and that he was, taking me seriously in my pain. And I mean, I had shoulder pain, I had pain in my hands, pain in my feet, back pain, a lot of back pain, foggy memory. I felt like I couldn't think, make decisions. I really, at times, felt like a vegetable with a lot of anxiety at the same time. It was just a very weird existence at one point. And so I really felt like I made the right decision and come here because Dr. Corey didn't give me all these meds that were prescribed to me. He did make some. What I liked is that he treated me holistically, and that he offered dietary changes, exercises, stretches. Because I also had pain a lot in my chest. A lot of my ribs seemed to pop out of place, and that was excruciating pain. And he gave me exercises that I could do, which I thought what's the word? I couldn't believe that one day I could move with the kind of movements that he was recommending, and now I can, and I sit comfortably and I feel comfortable, and I think I've gotten beyond the point of the pain there. But anyway, there were times I would wake up with tight fists like this, and my body was constantly tense. So, and I'd wake up with a lot of nausea, and it felt like I couldn't even eat. It was a big mess. So it's been a few months, and I am thankful that in the short amount of time that I have seen Dr. Corey, there have been great improvements. I gave my other doctors definitely about a year, and I just felt I was getting worse and worse, and to the point where I was thinking, wow, can I even go to work? And so with the time that I've been here, a few months, I would say about a half year, I felt like I've improved a lot, and I'm just very thankful to the staff who've been really kind, and Dr. Corey, who's just also been just a great listening ear, and just someone with a wonderful bedside manner who is there for you, and is there to help you in any way. Let's see. So if you have similar symptoms, I just really highly recommend Dr. Corey. He's done a lot for me, and I just hope that you can find your way here and also experience the difference. Thanks.